Due to the COVID-19 pandemic, many routine appointments and non-urgent surgeries have been canceled or postponed. In addition, pediatricians throughout the country have seen a significant decline in the number of well-check appointments and routine vaccinations. Today, we're joined by Dr. Kimbrough, CHoR pediatrician, to learn what it's like, why it's critical to keep up with well checks and vaccines even during a global pandemic. Thanks for joining us today, Dr. Kimbrough.
Thanks for having me.
Okay, so to start off, why is it important that kids receive well checks and vaccines during COVID-19, even if they're seemingly healthy?
That's a great question. So, during well checks, we're doing a lot of things to make sure that kids are continuing to thrive. One of those things we're checking on is growth. Children grow really quickly, and so it's one of our early signs if something may be not going as it should and that we can intervene on. Along that same line, we're also checking on development. As parents know, kids are changing constantly, and we want to make sure they're meeting those milestones on time. And again, picking up early if there is something that's a little bit amiss. And then vaccines are a critical part of those checkups for most children in their early life. So we're getting those vaccines given on the schedule to help keep kids safe and healthy.
Okay, awesome. So how often should kids be receiving well checks?
That's a great question too, and it changes depending on how old the kiddo is. So infants are usually coming in every 2 months, spaces to every 3 months, then every 6, and then it transitions to yearly in early childhood. And the main reason that it happens on that timeline is partly to do with vaccines, but also partly how quickly children are changing so that we can adjust and give parents the advice and recommendations they need for those transition times.
Yeah, it's good to know that they're different for different ages.
Mm-hmm.
And kind of keep that in the back of your mind. But what about kids with medically complex conditions? Are they going to well checks more often, or are they on the same trajectory that every other kid is?
Yeah, so I see a lot of the children with special healthcare needs here at CHoR, and depending on how complex or changing that child's illness is, they may need to be seen every 3 months, every 6 months. It really depends on their overall trajectory and what's going on with them. And we have an option of doing telehealth visits where it's appropriate for those children with special healthcare needs to check in and see how things are going.
Okay, and just to roll off of that, is CHoR offering telehealth well checks for everyone?
Yeah, so we are really lucky that AAP, the American Academy of Pediatrics, has advocated on a national level for well checks to be covered under telehealth visits by insurers. That being said, it's not appropriate for every checkup because we can't give vaccines remotely. It can be challenging to check on growth, but it's something that we can do in a creative way if it's appropriate for the kiddo. So there are times where telehealth visits are absolutely appropriate, but times where they're not. So it really is a case-by-case decision between the parent and the healthcare provider on if that's appropriate for the child.
Yeah, that's awesome to know. I know that telehealth has been saving a lot of families like many crazy trips to the hospital or pavilion during this time. So it's awesome that they're offered for those routine appointments. So out of well checks, vaccines, everything, are there certain appointments that are most important or more important than others?
So I would definitely say that those infant appointments where we are really closely watching growth development and providing vaccines are the most important for the vast majority of children. There are going to be exceptions for older kids that we do need to see, in person, but we can get a lot of information from telehealth visits. We can do a pretty thorough physical exam, get a great history, chat with the kiddos, see their family, see what's going on at home. So those visits are very illuminating, and for a lot of families are sufficient, but it really just depends on if there are things that we do need to physically lay hands on. If we're following, a heart murmur, we have a kid who has more going on that we need to actually examine them, that we would want to see them in person.
Okay. And what about vaccines for older kids and teens? Is there timing of those that's super critical that they cannot miss? I know that there's some vaccines that are on kind of a 3 vaccine plan and schedule. What about those?
Yeah, so most of those ages are going to be 4-year-olds and 11-year-olds, and they are tied with school entry. So a lot of times children's ability to start school will be tied to if they've received those vaccines. So we do want to make sure that if it's a visit that the child's due for vaccines, that we see them in person so that we protect them, but we also keep their ability to enroll in school when that is, opening safely.
Okay, great. So for families that do need to come into the pavilion or any other CHoR facility, how is CHoR keeping healthy kids safe when they visit clinics during COVID-19?
Yeah, this is probably one of my most frequently asked questions right now, and I'm so proud of everything that is happening to make sure that families, patients, and staff stay safe. And this is mirrored across a lot of facilities. But what we're doing here at CHoR is we're doing a pre-screen, a few days ahead of a scheduled appointment, make sure everybody's feeling good and they're aware of what our policies are. We're also screening patients and families when they come in the day of their appointment. So when they come in, they get a symptom and a temp check. We're offering masks for families who don't have their own so they can wear them throughout the visit for children who are 2 and up, and then any family members. We're continuing to limit visitors, so 2 healthy caregivers and then no accompanying siblings or other children to the appointment. Social distancing throughout the encounter, so we're encouraging 1 family per elevator. We're really eliminating the waiting room, so meaning when families come in, they're coming straight back to a room where they stay throughout their visit, so they're not commingling with other families. We're limiting the number of in-person visits per hour. So again, we're decreasing the traffic that's present in the building at any given time. And then every staff member is also wearing a mask and then checking in with their own symptoms every day to ensure that folks are coming to work healthy and able to provide great care.
Yeah, that sounds awesome. And like a lot of additional steps, but it's important, and it's a really important time that we're all doing that together.
Mm-hmm.
So, is CHoR and just pediatricians nationally, are they seeing a drop off in any specific vaccines, or is it just across the board?
Yeah, so that's a great question. And both the American Academy of Pediatrics and the CDC, the Center for Disease Control, put out a press release looking at vaccine rates across the country. And so one of the things that they've noticed, beginning about mid-March through mid-April, we have data for so far, that the rates of vaccines that are ordered nationally, it's one of the ways we watch vaccine administration, was down 2.5 million doses for that month compared to the same exact time frame the year prior.
Wow.
That was all vaccines, but particularly worrisome, measles containing vaccines were down about 250,000 doses for the whole country. And so as we know, measles is a vaccine preventable disease that spreads very quickly in unvaccinated or unprotected folks. So we've seen outbreaks of measles, like in the Disney outbreak a few years ago. And that's one of the things we're worried about when we see vaccine rates trend down.
Yeah, and I mean, we don't want a vaccine preventable outbreak on top of what's going on right now. So
exactly. And a lot of families ask, well, we're home right now, we're social distancing. Does it really matter if we're getting our vaccines on time, if we're not around other people? And some of these vaccines are for, person-to-person exchange. But just remember too that your kids are going to be outside playing all summer. And so one of the important things that we want to make sure they're protected from is also tetanus, which is present in the soil for those routine, scrapes, cuts. Kids being kids, we want to make sure that they're able to enjoy the outdoors without that additional worry.
Yeah, that's super important. So summer, this is a big time of transition for a lot of families, and kids are getting older, might be heading off to college somewhere away from where they were raised in the fall. What is the best and easiest way for them to get a record of those vaccines, or get them all into one document in one place so that they can send them to school or send them to summer camp or wherever they need to go?
Yeah, so there is a report in every patient's portal of all the vaccines that have been given to date. If families are having trouble with their portal or they're not signed up for the portal, they can definitely give us a call. They can also call us directly and we can print that out, that report out, and fax it directly anywhere that they need that report to be sent off to, in addition to completing any screening forms that need to happen either for school or college entry.
That's awesome. Definitely better than the record that I had when I went to college. I think it was all handwritten on a piece of cardboard. But so for vaccines, can those be a standalone appointment for people, or do they need to accompany a well check for a patient?
So that's another really great question and one that we get asked frequently. And there are definitely situations where a nurse visit where you're only getting vaccines is appropriate for some patients, and then we can complete the rest of a checkup via a telehealth visit. There are other times where if you're going to come in anyway, you might just well finish the visit, and it might be more appropriate for your child to do it that way. But that's a case-by-case situation, and we are doing a blend of that, of some nurse visits and some full checkup visits.
Okay, great. And you've touched on this a little bit, but are there any other major risks of missing or not getting any vaccines, or missing one that's in a series?
Yeah, there's a few. One of those being we are, concerned about possible outbreaks on top of the COVID pandemic. So if we start to see a whooping cough outbreak or a measles outbreak, that would be something else on top of the COVID pandemic to potentially overwhelm hospital systems and the healthcare infrastructure. Another thing on an individual level that I counsel my families about is that their child's fever plan looks very different if their child is up to date with vaccines or if they're under or unimmunized. Meaning that fever is common with routine child illness, but the chance of it being something that's more severe or significant is higher if your child's not protected against those routine vaccines. So that may mean your child needs blood work for fevers or needs a shot of an antibiotic. And so the degree of how invasive that fever evaluation is really is dependent on your child's vaccine status. And so just being well informed about what choices you're making as a parent, just knowing that we may need to do more if their child is not properly vaccinated.
Yeah, and I'm sure no kid wants to go through those extra steps. If
Nobody
they have,
likes getting blood work drawn.
no, or extra shots and vaccines. I know I don't.
Yeah.
So what should families do if they have any questions or concerns about coming in for well checks or vaccines?
So we're here for you to answer all of your questions. I know right now there's probably more questions than ever about what's safe and what's not, and what is the biggest risk to my child, and what is that risk benefit ratio. So we have been having a lot of these conversations, and we'll continue to do so to help families navigate this time. But just know that we are here. We are encouraging families to come in, and we're taking every precaution we can to make that experience safe and meaningful for families.
Yeah. And if you have any questions for Dr. Kimbrough specifically about vaccines or well checks, please leave them in the comments below. Still, we have our COVID-19 website. Our website is a wealth of knowledge with contact information, requesting appointments, phone numbers, anything you need. So thanks for joining us today, Dr. Kimbrough.
Thanks again, guys.